Good evening, everyone. I'd like to call the City of Menasha Administration Committee meeting to order. Clerk Krautkramer, could we have the roll, please?
Alderman Nichols.
Here.
Alderman Taylor. Alderman Sevenick. Alderman Langdon. Alderman Schmidt. Alderman Tom Grady. Alderman Ted Grady. Alderman Rapella. All are present.
Thank you. We have minutes to approve from the Administration Committee meeting of September 20th, 2021. Is there a motion? Alderman Rapella.
Yes, I'll make a motion to approve the Administration Committee minutes for 9/20/21.
We have a motion from Alderman Rapella and a second from Alderman Tom Grady to approve the minutes. Any questions, corrections, conversation? Seeing none, all in favor signify by saying aye. Any opposed, nay. Minutes are approved. Our first item of business this evening is the Mutual Properties Insurance Company renewal policy quotes. Attorney Captain has some information to share regarding this renewal quote. Attorney Captain?
Thank you. What's before you is the renewal quote for 2022. There is something missing, however. It is the 455 Baldwin Street Municipal Public Works Facility. We had it removed from the policy because it, we had taken down the old one and put up a new one. We provided the information. The way that it works with respect to the policy is once the building was completed, we notified them, so they have it. But it doesn't get put into the policy until the following January, except they missed it. So they are in the process of adding that facility, and I did also notify them about the cold storage building because that is expected to be completed by the end of this year. And they did not get me back the updated premium quote. I had just received this just before it was placed on the agenda. And so I guess what I'm asking is that we forward it to the Common Council, and we will have to substitute and add the amount for those two buildings as soon as I get them.
Thank you for that. Any other questions for Attorney Captain? Seeing none, is there a motion? Alderman Sevenick.
I'll motion to refer to this to the Common Council for the Mutual Property Insurance Company renewal policy with a quote that we can take up at that meeting.
Motion by Alderman Sevenick and seconded by Alderman Ted Grady to forward the renewal policy to the Common Council. Any further discussion? Seeing none, we'll take a roll call vote.
Motion carries 8-0.
Thank you. Item number 2 this evening is the storage tank liability insurance renewal. Attorney Captain, would you share information on that, please?
Yeah, this is just the renewal for 2022. The price reflects, I think it's about a 5% increase from last year. And I would ask that the renewal be forwarded for acceptance to the Common Council.
And the premium amount there is $1,294.
That is correct. And you'll notice that it's a little bit different now. We got obviously a better rate since the tanks were changed.
Yes. Any other questions for Attorney Captain? Seeing none, is there a motion? Alderman Rapella.
Thank you very much. I'll make a motion to approve the Mutual Properties Insurance Company renewal policy quote.
We're
Wrong
on
one,
item-
sorry. All right, my mistake, I was doing two things at once. Approve the storage tank liability insurance renewal.
in-
How much was it, Stan? Oh, you got it? Oh, I got it, for $1,294.00.
And is there a second?
Thanks.
We have a motion by Alderman Rapella and a second by Alderman Tom Grady to forward the storage tank liability insurance renewal to the Common Council. Any other discussion? Alderman Rapella, did you have discussion?
No, no.
Okay. Seeing none, we'll take a roll call vote.
Motion carries 8-0.
Thank you. And our last item this evening is the 2022 Employee Health Insurance Coverage. Attorney Captain will review this information for us. The one thing that I would like to point out before I turn it over to her is that on page 2, where you see the recommendation and then the plans outlined, underneath that, there's the current plan, which is in existence today. There's two of them, current Plan A and current Plan B. And there are 4 proposed plans for next year, and they are included in the recommendation, the 4 of them together. Attorney Captain will explain that a little bit more and review the other information for us.
Thank you. For employee health insurance for 2022, there are actually, I guess, 2 options. The first option, as I had referenced earlier in the memo, is with respect to our current carrier, that's WEA. They came back with an 11.9% increase to the premium. And so that would apply to Plan A and Plan B. That is one of the options. We currently have a Plan A, Plan B, so to have everything the same, it would be an 11.9% increase. Alternatively, we did receive one other quote, and that quote did lay out a number of different plan options. And what is shown to you in the memo are 4 plan options. There were other plan options that were more similar to what we currently have, but the premiums were, not anywhere competitive. And so these plan options were the most competitive and are, or would be, offering employees something similar to what they have now with respect to a health insurance plan. Network Health, obviously located in Menasha, they are contracted primarily with healthcare provider Ascension. Their primary option is an HMO. I think everyone's probably familiar with an HMO. You pay the premium. If you need health care from a provider, you go to their healthcare providers. And if you go to another provider, you pay on your own. It's not covered. And so that's what is reflected in proposed Plan 14 and 13 there, which are both HMO plans. Currently, the difference that employees have under Plan A, Plan B has to do with whether or not the first dollar paid by the employee towards prescriptions, is it paid towards the deductible or is it not? And so that's the difference between these two HMO plans. So one does offer employees an opportunity, if they want to, just have Ascension as their provider. They can select whether or not they want to have the first dollar paid go towards prescriptions, or alternatively, and they have to meet a deductible. I guess I should have said that. It's the same $1,500, $3,000 deductible that employees had. So all four of these plans have a $1,500, $3,000 deductible. In addition to that, there obviously would be a premium. There would be a copay then under one of the HMO plans for prescriptions. The other one, you pay first dollar towards your prescriptions until you reach the $1,500 or $3,000, whatever, and then there's copays after that. The other plan that they are offering is a point of service plan, and network did agree to allow ThedaCare to be considered as in-network for the purposes of the $1,500, $3,000 deductible. And so employees could select a point of service plan if they chose to have a ThedaCare provider. And then the same option, the reason why there's two of them, 15 and 16, has to do with that first dollar prescription coverage. And does it go towards the deductible, or are there copays? We did find out that there are, I want to say approximately half of our employees do seek medical providers that are ThedaCare. The other half have Ascension, and I say it's about half because there obviously are a few more other providers that some employees see, but it's not a significant number, let's put it that way. That is just in analyzing what the bills were that have been paid, approximately half. And there was also something that we had sent out to employees earlier in the year, which indicated, there's approximately half that use one, half that use the other. So this would be a change, obviously, for employees to move the insurance carrier to Network Health, but it would be to offer it as close as possible to what they have now. You can see what the premiums are. Obviously, the total dollar amount, you don't really know until employees would sign up for it. What we currently have is an HRA where, I don't know if you recall this, but the employee pays $1,500, $3,000 for a deductible, and then on top of that, there's another deductible of $1,500, $3,000 that the city was contributing towards, and that those were all, or those two plans that we currently have are HRAs. And so what is being proposed is that there still would be a city-paid HRA component. It doesn't work the same way, however, and it would be based on what plan the employee selects, with the HRA component ranging from $250 to $1,000, depending on what plan they select. The thought process behind it is the higher contribution would be for those employees that selected the lowest cost plan. And then the 250 would be for those employees that chose the more expensive plan, to try to encourage greater usage of the lower cost plan. And so, as far as the bottom line is concerned, Mayor, do you recall there is a small savings, as I recall, right?
We're pretty
about the
close
same-
to
about the same?
same number as the 2021 budget is about the same as the 2022 budget. I don't know exactly how much over, under it is.
Yeah, and of course, that is always a difficult thing all we do is, we're able to estimate, obviously, because we estimate based on, number of plans and who takes what plan. And so we look at this year, what plans have been taken, and then kind of estimate how do we fit people in. And it looks as though that's what it would be, approximately the same.
And our estimate was based on 50% of the people taking the POS plan and 50% of the people taking the HMO plan. And then the same employee, spouse, employee, or family plan.
But just looking at, like, over the last few years as to the actual dollar amount for the health plan, and this does not include the HRA component, is, I want to say, about 1.5 million is what the total cost is, plus or minus, just because of, depending on what kind of plans are taken out. So there is a recommendation there that is in bold, changing the health insurance carrier to Network Health, along with changing plans, so that would be offering those 4 plans, and including a city-paid HRA component.
Go ahead, Randy's got his light on. Becky does too. No, she's the chair.
Oh, that's true.
Thank you.
It's a long day.
Well, actually,
Congratulations on being the chair.
I was waiting for you to finish your side conversation. That's why you had a
Thank you very much, I appreciate it.
pregnant pause there.
I did find out from
I,
Alderman Garage.
excuse me. I hadn't given you the floor yet, because I was about to say, thank you, Attorney Captain. There is as stated, there is a recommendation in our memo to change our health insurance carrier to Network Health, along with changing plans and including a city-paid HRA component. Are there questions for Attorney Captain? Alderman Rapella.
Thank you very much, Alderman Nichols, Chairman of the Administration Committee. I did find out my answer from Alderman Garage. I was just curious on what the employee would be paying per paycheck, and so we figured that out. So thank you very much, Alderman Garage, for informing me and helping me figure that out.
As the
Thank you,
memo- thank
Alderman Nichols.
As the memo states, the employee contribution to premiums for all plans would be 10%.
I want to know what the 10% was.
I'd like to make a motion.
Alderman Sevenick.
Thank you. At this time, I would like for us to recommend to the Common Council changing our health insurance carrier to Network Health, along with changing plans and including a city-paid HRA component. Additionally, employees' contribution to the premium for all plans to be 10%. And then I have a follow-up
And is there a
question.
second? We have a motion by Alderman Sevenick and a second by Alderman Ted Grady to change health insurance carrier to Network, along with changing plans and including the city-paid HRA component, and that premiums would be, employee contribution to premiums would be 10%. Alderman Sevenick, you had a question?
Yeah, I have a question for either the city attorney or Jennifer. You know, sometimes when you offer too many different plans, it becomes a lot more work. So I'm wondering, and I did see that the recommendation did come from you, the mayor, and the city attorney. So do you feel that by having all of this, that it's still workable within your departments, not juggling too many different plans?
I'll just kind of explain the reasoning with the 4 versus 2. Like obviously, if we would go with network, we wanted to offer the HMO and the point of service.
Okay,
So we could have done just an HMO and point of service. But currently, employees have the 2 options where they pay, Pam had mentioned, a copay for their prescriptions, or they pay their deductible. And when they meet that, then their copay for prescriptions would kick in. So these 4 plans basically offer those same options to employees, so less disruptive to them, if you will, that they would basically have an equivalent to what they're used to.
okay,
That's the reasoning on that.
okay. So you don't feel it'll be too overwhelming by having all these different,
That
Components?
part I can't exactly speak on, but as far as the reasoning for the 4, it just most closely matches
okay,
what employees have.
makes sense.
Alderman Langdon.
Thank you, Chair Brecky. So I don't think 4 options is, I think every place has that. I know where my wife works, they have 4 or 5 different options to choose from. But my question is we're going to be voting on changing. And so I just have I'm not comfortable with voting on this unless, Mayor, have you gone around and asked people if they want to change? Or are we telling you, people in City Hall, that you're changing because the 8 of us said so?
I don't think anyone likes changing health insurance plans, but also a 12% increase to the employee is a lot of money, and it's a lot of money in our budget. So what we attempted to do here was create a plan that was as similar to what they currently have as possible, and costs as close to the same as what they currently have as possible. I did talk to a couple people here and there, and the ones I talked to thought it was reasonable to do this. Are they happy about going through the paperwork? Not necessarily, but
Right.
they understand that this is something that you need to do, and most companies are changing every couple of years as well.
Yeah.
Our preference would be to stay with who we had, but that number was just way too big. Now, what they are excited about is getting rid of that second tier of HRA coverage.
Okay.
I did hear that from several people.
Okay.
So I think it's reasonable. I don't think people will be concerned about it.
Okay.
There will be a couple people with Aurora that will not be covered in here, but that would be the main problem that we would have.
Okay. Thank you, Mayor. That's what I was wondering, and thank you for that answer and that question. Yeah.
I just have one question. For the HRA piece, do we need to clarify for non-represented employees at this time in the motion?
If we have to, we can do it at council.
Attorney Captain.
Yeah, it would not apply, there's a contract, and so the contract indicates that they pay 10%. That HRA component would not be available to the union.
So I think the answer is no, am I? Okay. Any other questions? All right, we have a motion and a second. Seeing no other discussion, we'll have a roll call vote.
Motion carries 8-0.
Thank you, and with that, we'll look for a motion to adjourn.
Oh, hold on,
Yeah?
we still have the dental.
Oh. Okay. dental insurance, Attorney Captain?
So for the dental, I had a little note on there. We did include the budget. Showed you that for 2021, the costs of the plan are exceeding the payments that we are receiving. However, we do anticipate that there is, it'll kind of settle down. It's likely that some of that increase was due to lower usage in 2020. And the recommendation from staff is that we don't need to make a change as far as increasing the premium. There is one issue, I think I attached that there was something that we received from our consultant showing a difference in the standard of care with respect to dental. That apparently is a recommendation from our consultant. This would save a little money. It's wouldn't be a lot, but that isn't necessarily obviously why it would be recommended. But right now, I have in the memo with respect to x-rays for patients, apparently there's a change in the standard of care, and their recommendation is to make that change in our plan from 12 months to 6 months for bite wings and 5 years versus 3 years for a full mouth x-ray, because that is apparently what is going on.
So do we need to have a motion to
So
change that
would
standard of
be-
care?
That would be a motion,
Okay.
correct?
I did not realize that.
Okay.
And so with that, I mean, I'm comfortable with that standard of care. So I'll move that we change the standard of care to every 12 months for bite wings and every 5 years for full mouth x-rays. Is there a second? I'll second. We have a motion by Alderman Nichols and a second by Alderman Rapella to change the standard of care. Any discussion on that? Seeing none, we'll take a roll call vote. Clerk Carl Kramer, were you able to get that motion? I could repeat it. Okay. I just knew that you had gotten up from your seat, so.
It doesn't look like Rebecca Nichols.
Motion carries 8-0.
All right, thank you for that. And with that, we'll look for a motion to adjourn by Alderman Taylor, second by Alderman Nichols. All in favor, say aye. Aye. We are adjourned.